before entering my patient's room, I'm going to gather my supplies, my gloves, my worksheet, my medication, and some alcohol swabs. And then I'm going to perform hand hygiene before I go in the patient's room, and I'm going to introduce myself. So good morning, Sid. How are you today? I'm here to administer your diamond hydronate. Is that okay? Okay. And can I just get your full name? Sid Garland. Okay. And can I get your date of birth? 11/08/1965. 11/08/1965. Sid Garland. And MRN is 344316. 344316. Okay. Do you have any allergies, Sid? Codeine and penicillin. Okay. Just your wristband. Codeine and penicillin. Okay. Do you have any history of reaction to these medications? Okay. And what happens when you have had a reaction to these medications? Okay. Just going to set that down. And now I'm going to landmark my site. So the site is the right vastus lateralis. So to landmark, it'll be 1 hand breadth above the patella, and then I would find the greater trochanter, and it would be 1 hand breadth below the greater trochanter. This obviously isn't to size, but that's what the landmark would be. And then the site would be the lateral aspect of the thigh, just the outer vastus lateralis muscle right here. So the site would be right about here. And before performing the injection, I would assess the site for any redness, any nodules, any swelling, tenderness of the site before performing this. Okay. And then I'm going to don my gloves. And then I'm going to clean my site. So I'm going to use circular motions, going outward to clean the site. And then I would allow that to dry before performing the injection. So for the injection, I'm going to use my non-dominant hand to pull the skin back, laterally, 2.5 to 3.5 centimeters. And then I'm going to use my dominant hand to uncap medication, and I'm going to inject at a 90-degree angle. And once it's in, I'm going to pull back on the, I'm going to hold it with my non-dominant hand, and I'm going to pull back on the syringe to aspirate for blood. And there's no blood in the syringe. If there was, I would remove the needle, and I would prepare a new syringe and a new syringe of medication and perform the same process again. And since there's no blood return in the syringe, I can go ahead and inject the medication. So I am going to inject at a rate of no more than 1 milliliter for every 10 seconds. And once the medication is administered, I'm going to hold for just 10 seconds. So I'm pulling back the skin to administer this medication using the Z-track method. So after 10 seconds, I'm going to remove the needle and let go of the skin. And I'm not going to massage the site. I'm going to cap. And then I would dispose of my sharps in the, I would dispose of my sharps into the sharps container. I would remove my gloves at this point. And then I would provide health teaching to my patient. So this medication may cause drowsiness. It is important to avoid driving and other activities that require alertness. So it is also important to avoid alcohol and other CNS depressants while taking this medication. And then for post-assessment, I would return in 20 to 30 minutes. Since the onset is 20 to 30 minutes, I would assess for any signs of reaction, and I would assess the patient's nausea and nausea at that point, and if they have any vomiting. And I would assess for any adverse reactions such as drowsiness, dizziness, or a headache. So at this point, I would leave my patient in a comfortable position, and then I would go over to my MAR to document. So we're just going to head over. I'm going to document that I gave the 6 o'clock dose, so I'm going to include the date. I'm going to include my initials, a line for my co-signature, and then the site, which is the right vastus lateralis. And that's it.